This is the NEU's weekly report on COVID in schools following the wider open on the 8th of March. Thanks for watching and listening. We'll say something about Bolton and the Indian variant in the course of this. However, the overall case numbers continue to be very low. Some small indications of a national starting to rise, but with the spread of vaccination, there is good reason to hope that that will not become the situation that we had earlier. If you look at all the nations, they remain currently all at very low levels, and all the regions similarly. There is variation, but it's at low levels. When we look at school ages, they continue to be low. There was some evidence of a small uptick in primary ages, but it's at very low levels, and it's hard to be certain if that's happening. We therefore can say that according to the ONS coronavirus survey, for age 2 to school year 6, it's 1 in 570 children have the virus. That's the same rate as the 12th of September last year. School years 7 to 11, it's 1 in 1,100. That's the same as at the 7th of September last year. And for all ages, it's 1 in 900. Again, the same date as same as the 7th of September last year. The scientists do think that R is edging up. They expected that as wider opening happens. The question is how much the rollout of the vaccine will impede this. They're still not certain whether R is above or below 1, but it's around 1 in all the regions of England at the moment. The Indian variant does exist in the country, but on this map, all those black areas are areas where there are absolutely no cases of the Indian variant. And the darker the colour, the lower the number of Indian variant cases there are. So in a vast majority of the country, there's hardly any Indian variant at all. However, when we look at these are the areas with most of the Indian variant. We are sequencing so many genetic sequences following the PCR tests that you can be fairly certain that these are the areas where the Indian variant exists. Bolton, Blackburn with Darwin, you can see there, and they're arranged in that sort of numerical order. In some of these areas, the cases have begun to fall again. So that's what we have to look for and keep looking at. Bolton is in the worst position. And you can see that the red line, the highest line, is for children aged 10 to 14. The green line below it is for children aged 15 to 19. So the cases are higher amongst school-aged children. But that is at least partly because the other ages have been vaccinated. So it's not just the question of whether the cases are rising, but the question of what they're arising as what proportion of the total cases. You see the same pattern on this totalizer showing again that the red bar at the bottom is cases of children aged 10 to 14, and they're a significant part of all the cases, and 5 to 9s below them, 15 to 19s above those. So we have to keep looking at Bolton, but we've got to keep doing what we can everywhere else. We need children to carry out and parents to carry out lateral flow device tests. The drop in those seems to have stopped. We should be using assemblies and other opportunities to encourage children to do the testing. Finding some cases will help. Having said that, with those cautionary notes, hospitalisation continues to fall. And even on the log graph, it still seems to be, so this is a graph with a log scale going 1, 10, 100, 1,000. The cases are still falling on hospitalisations and even more strongly on deaths. So this is the log scale of deaths, and the line is getting steeper and steeper. And that's the result of the vaccination rolling out. When you get offered a vaccine, do take it. Outbreaks in schools are more or less the same as they were last year. Last week, a very small increase. There were 25 outbreaks. That's 2 or more cases in primary schools. That's 1 in every 700 primary schools. There were 22 in secondary schools. That's 1 in every 190 secondary schools. And there were 5 in special schools. That's 1 in every 320 special schools. So the cases, the outbreaks are low because generally cases are still low. And because of that, attendance is higher than it was certainly back in November. So primary attendance is at 95%, apart from Thursday of the last week, for some reason that we don't understand. It might just be a fault with the data. Secondary attendance 89%. Secondary attendance would normally be a bit higher than that, and the DfE is actually doing quite a lot of work to try and work out where those children are, because they aren't off directly because of COVID. So 1% of children were off because of COVID, 3,000 because they had a positive PCR, but 65,000 were self-isolating because they were close contact, either of a contact at school or at home. The vaccination continuing to spread, and on the 70 plus bar here, that very dark blue means that almost everybody 70 plus has now had 2 doses of the vaccination, and we're in the 50 to 69 bracket, we're up to nearly a half, or at least over 40% of having had the double vaccination, and spreading now down to 30-year-olds, 34-year-olds. And the union will keep telling you, when you become eligible to have a vaccination, do go for it as quickly as you can. And we're continuing to share materials produced by one of our members, but with the Stephen Hawking Foundation, which look at the questions of vaccine hesitancy. You may have seen a media story suggesting that in some of the inner London boroughs, the vaccine rates are quite low. But it's important to be clear what that means. I think they've said Tower Hamlets is 35% vaccinated. That doesn't mean there's an incredibly low take-up in the age demographics in Tower Hamlets. What it's actually telling you is that Tower Hamlets has a very young population, and so there are a great many more young people there who haven't yet been vaccinated. That still does matter, obviously, because spreading the vaccination impedes the spread of the virus. So that makes it all the more important than in Bolton, in Tower Hamlets, across the whole country. We are in favour of keeping masks until it's clear that the vaccination is winning out. We're in favour of using the lateral flow devices to find asymptomatic cases. Ventilation really does matter. In-person staff meetings shouldn't be happening. And it's not just us that says that about masks. The London School of Hygiene and Tropical Medicine said it on the 5th of May. The World Health Organization and UNICEF continue to say it. The last 3 slides here, we've still got our website that you can look at to see what the case rate is around your school. Our health and safety advice is still there, and our education recovery plan. Thanks for watching. Please share, keep safe, get your vaccine, ventilate your classroom, keep mask wearing going, and encourage children to do the lateral flow tests. Thanks very much.